Good morning. My name is Maria Heaton. I'm here to very briefly discuss our family's journey through the health system. The way in which doctors reveal a child's diagnosis or discuss the intellectual ability of a child can have a huge impact on the family's journey and the way that parents perceive their child's diagnosis. My paper revolves around my family, and therefore I would like to introduce them to you. My family comprises of my husband Fabian, an avid cricketer, eldest daughter Danica, 20 years, who is in a final year at uni, son Tristan, who passed away last year, just 2 months short of his 18th birthday, and my youngest daughter Tiarna, who passed away when she was 3 years old, and myself. Tristan and Tiarna had a diagnosis of Leeson-Kefeli. Leeson-Kefeli is a neuronal migratory disorder. The surface of the brain is either smooth or has abnormal folds. Both Tristan and Tiarna had the severest form of this illness. As a result, they had profound physical disabilities, presumed severe intellectual disabilities, an intractable seizure disorder, difficulties with swallowing, gastroesophageal reflux, sluggish bowel, irritability, predisposition to respiratory infections, obstructive sleep apnea, and most debilitating of all, severe muscle weakness, mostly affecting their respiratory muscles. This is what proved to be fatal for both Tristan and Tiarna. One parent, Emily Pearl Kingsley, compared the disability experience to an overseas trip of a lifetime. You have always longed to visit Italy. You have studied the language, the people, the climate, and the food. You're looking forward to the vineyards and beaches. Your bags are packed accordingly. You board the flight filled with excitement, and as you prepare for takeoff, the stewardess says, "Welcome to Holland." You're in shock. What are you doing on a flight to Holland when you are expecting a trip to Italy? You are angry and upset and want to get off the flight, but you can't. You are going to Holland whether you like it or not. You can deal with it in two ways. You can choose to hate Holland and be miserable and unhappy the whole time, or you can make the best of it and choose to learn about Holland and enjoy your visit there. You could think positively and think that things could have been a whole lot worse. You could be going to maybe the middle of an African jungle or an Indian desert, and Holland in comparison is actually not too bad. Tristan had his first seizure when he was 12 days old at about 7 a.m. and by 5:30 that very evening, Tristan had a confirmed diagnosis. When diagnosed, the doctors painted a very bleak picture. They told us that he had an anatomical abnormality of his brain that was incurable. They also told us that Tristan was most likely blind, deaf, and that his intellectual ability was so poor that he would most likely not even recognize us as his parents. I was devastated by the news, but Fabian told me that until the previous day we had thought we had a normal child. Tristan had woken regularly for feeds. He had cried with a dirty nappy and settled when cuddled. He talked positively about every diagnosed child not displaying textbook-like signs and symptoms. When parents are given their child's diagnosis, it is a good idea to find out about the parent's background and how much they know about the condition. Parents need some positives in the discussion. It is important that doctors have up-to-date information about the condition when talking to parents, and it would be excellent if some reading material was available for the parents to take home. When I asked for reading material, I was handed a 1978 article about the autopsy results of children with Leeson-Kefeli. In this article, it mentions that agyria results in such a primitive brain structure that even a mouse has a more sophisticated brain. Suffice to say that I did not read further. It was many months before I could read or look up anything about Leeson-Kefeli. Together as a family, we made a decision that the focus for our children would be for them to have the best quality of life possible. While caring for my children, my main concern was whether I was doing the right things for them. I cuddled them, fed them, washed them, changed them, and followed all their medical procedures. I was sure that I was taking care of their basic needs. But was that enough? Kids with intellectual disability need to have as many opportunities and have a right to enjoy life as much as other children. Therefore, as a family, we set about consciously seeking ways in which to provide Tristan and Tiarna with the best quality of life that they could enjoy. My husband and I discussed what was most important to us. We wanted to show Tristan and Tiarna how much we loved them. We wanted Danica to have happy memories with her siblings. It was important to us that the focus of our lives was not their fragile medical state, but the fact that we had two beautiful children. We began to think positively and do fun things, and we discovered that indeed we all had a great time. Although we were advised otherwise, it was important for us to believe that Tristan had some cognitive ability. Believing that a person's cognitive ability is poor can be very damaging for the person because it discourages social interaction and the development of social relationships. Labeling a child with poor intellectual ability is the harshest sentence. In fact, intellectual ability is very difficult to measure in people with severe physical disabilities. Every child needs regular stimulation, human contact, variety, and color in order to develop. There is documented evidence from the cases of orphan Romanian children about issues with developmental delay and psychological damage due to their institutionalization and abandonment. In order to make any progress with children with intellectual disability, they need much more regular stimulation. This takes a lot of time and effort. We wanted to give Tristan the same care that we had given his older sister. We invested a lot of time in talking to him, reading him stories, playing music and story cassettes in his room. My husband Fabian and I developed the habit of talking to Danica for Tristan, getting her to ask him to borrow his toys and thanking him for sharing. We included him in all our conversations, and she did too. Due to Tristan's prognosis, he was not linked to any early intervention program. We were told to take him home and love him, and that he would die within a month. Even when Tristan continued to survive, we were not linked to services. The whole world of definite communication began at 4 years of age. I took him to have a developmental assessment, and a wonderful doctor referred us to the Institute for the Deaf and Blind. The Homestart consultant Trisha from the Royal Institute for the Deaf and Blind taught us the best ways to communicate with Tristan. A simple test by the orthoptist revealed Tristan's visual ability. It was demonstrated to us the best position to show him things, how close to his face we needed to be for him to see us, and how close to the television he needed to be seated in order to view the screen. This simple information helped us to commence effective communication with Tristan. Trisha was able to teach Tristan to lift his right hand for a yes response, which is very definite and consistent. This method of communication has assisted us to obtain feedback from Tristan regarding his preferences. We are able to ask him what he would like to do for the day, if he is tired and wants to sleep, if he wants to be left alone, and if he would like to stay up past his bedtime. As time has passed, Tristan's body continued to weaken. He got weaker and was no longer able to raise his hand, and we were using a smile for yes and a shake of his head for no. One day, however, I noticed when I was talking about going to the movies, Tristan had his hand in his lap, but his thumb was up, and he was able to definitely give us a thumbs up, especially when it's an emphatic yes. In spite of Tristan's very severe physical disabilities and being nonverbal, we were able to use his various facial expressions to gauge his mood and needs. He had different facial expressions, and we were able to learn from his expressions when he was tired, when a seizure was imminent, when he wanted to be left alone, his cranky look. We usually got this when he was watching a movie and we either blocked his view or moved him away from the television, and when he was just being cheeky. He had a great sense of humor. He got every joke that we made. He also had this mischievous look when Danica was in trouble, as though to say, "Thank goodness it's not me." Just by using his gaze, he was able to make choices. When offered a choice of 2 different things, such as 2 movies, he had a good look at each object and then rested his gaze on the one he chose. Although Tristan's vocal response was very limited, we were still able to utilize it to understand his needs. An intermittent low moan meant he was tired, a continuous low moan meant that he was uncomfortable, and a squeal meant he was happy. Our strongest feedback from Tristan, as an indication of his contentment and happiness, was a big smile in response to our interaction with him. It was important to us that everyone involved in Tristan's care was able to communicate with him. We appreciated it greatly when medical professionals took the time to introduce themselves to Tristan or do anything to acknowledge him as an individual. Just the simple gesture of directing a hello to him made us so happy. Even if questions were directed to Tristan, we were aware that Tristan was unable to respond to them and one of the family would need to respond instead. But it acknowledged him as a person, and as parents, we really valued that. I have amended my previous presentation to briefly explain how difficult I found Tristan's last admission to hospital in May 2014. I have been involved in advocacy since 2002 for better health care for people with disabilities. I work in a hospital and I have a health background. None of this seemed to help me to be able to communicate effectively with the team involved with Tristan's care. They incorrectly identified that he was in a terminal phase and therefore did not try to resolve health problems that was causing Tristan great distress and was immensely difficult for us to see our son suffer. They repeatedly tried to send Tristan home when I did not feel that the issue which had brought us to hospital had been resolved. We even went to another hospital in a non-urgent elective way to get a second opinion about his urinary issues, and the service refused to see Tristan. It has been difficult for me because I feel like I failed Tristan in his final days. What this experience emphasized to me was 3 things. First, it can be so hard to accurately diagnose someone who has physical and intellectual disabilities. You need to follow a process of elimination and listen to them and their carers. Second, health services are busier, and therefore having a good attitude towards people with disabilities and considering them a vulnerable population and therefore care for them as any other priority population. And finally, I noticed the increasing role of the junior doctor in decision making. I feel that the communication between the junior doctor and the consultant is so much more important due to increased time constraints. In our 2 final admissions, decisions regarding discharge and treatment was made with information passed on to the consultant by the resident. The consultant did not actually see Tristan in both instances. I need to very quickly mention that finding mental health support for someone like Tristan was very hard, but it is needed and Tristan deserved it. I communicated with him about his dying and addressed his anxiety using storybooks. The books were called The Invisible String and The Next Place. I feel that it helped Tristan's anxiety, which we had been incorrectly thinking was pain, and kept administering morphine when his distress was related to his fear of dying and our separation. I would like to end by saying that Tristan and Tiarna gave us so much in their short lives, and our wish is to keep their memory alive. Tristan's favorite singer was Bruno, and if you look for Tristan Heaton in YouTube, you will find a video of him that you can watch and share with your friends and tell them about this boy who has motivated his mother to advocate for people with disabilities to have better health care. My most important take-home message to you is to please never let fame, fortune, personal glory, power, or politics get in the way of your focus in your careers, which is to always keep your patient front and center. If you feel yourself losing this focus, just remind yourself of Tristan and let him motivate you to be the best doctor you can ever be. Thank you.